We set up senior citizens so that it can be customized to fit individual and changing needs. And I think that's what makes us different than every other organization that works with aging throughout the country, is we always start with that person whose focus is on, let's fill the gap. And that's what our Navigators do.
I just call. Each thing that I think that I need a little something or whatever, I just call down to the senior citizen. I had my grandchildren going on this year, it'll be 10 years. And the peoples and stuff called me about 2 days after that, asked me, do I have this in the bathroom? Do I have that in the bathroom? The little things that I can get in and out the tub. If you have any question about Medicare, you could call senior citizen and ask question about it, and they would answer it for you and help you. They get the discount on utilities and get you some help for the lights. If I didn't have those resources and whatnot, I wouldn't know how to sit to find it. Just one place. There's one place at the senior citizen, and talk to somebody, and somebody connect you with the right person. They're real sweet people.
We have our own kitchen, and that staff is devoted totally on making sure that the food they provide is nutritious, but best of all, great tasting. And our director of our kitchen says that she always thinks about her mom and her grandmother when she's cooking. Is this something I would serve to them? But for me, the value of Meals on Wheels is that there's somebody to check on you every day, somebody to have a conversation, and someone to care about you every single day.
I was really surprised and impressed with the balance that the meals have. When I talk to people, I say, well, at least I get my vegetables and my fruits, where otherwise I would probably be eating some junk food, some French fries, and some hamburgers or something instead. But this way we get a nutritious, balanced meal. And everybody in the staff and everything are so friendly, and we're very satisfied with the service.
We've got 3 neighborhood centers throughout our 4-county region, and every one of them has just their own unique personality because it's driven by the people that attend.
And that's why I love Hinesville today. I don't even miss Chicago because of where I am in my life, and going to over there with the Senior Liberty Senior Center. And then, she has so much she does so much for us. And I think it gives me the energy, the strength and the energy to do things, to live on my own, at the age of 73, to live on my own, to do things by that center sitting over there. And then I think it was United Way used to bring food in. They would bring boxes of food in, and knowing we couldn't carry them, but they would give them to us. United Way, they would give it to us about, like Thanksgiving, Christmas, stuff like that. And when they come into the center, they just come in with a big, bright smile, and I love it.
We feel so fortunate to be the site of a senior companion program. It's a national program, but ours has been recognized several times for being really creative and inventive on how we utilize our companions. And the goal is for both to have a great time and have a great experience.
Is to encourage them to be successful and know that they can do things on their own, and if they need help, I'm there to assist. It's in activities like bingo, or with coloring, or exercising, or dancing. We're there to have fun. And I'm also there just to listen sometimes, because sometimes they want somebody just to hear them. I think of them before I think of myself. What can I do for them today before I think about what I can do for me? And I go to bed, they're the last thing on my mind. When I wake up in the morning, they're the first things on my mind. And I just can't wait to get out and be among them. They have a value, and they have something that they can give. And it's always something you can learn from them.
You know, unfortunately, some of us, because of health needs, get to a point where we can't stay by ourselves for any significant period of time. And that's where our adult day health programs come in. What their families know is that someone's paying attention and someone's taking care of them so that they can relax and they can work and focus on those things that they need to do.
My husband of 21 years has Parkinson's disease and Lewy body disease. And through the years, he has declined. And a couple of years ago, he got to the point where he couldn't be at home any longer. And I found the Ruth Bick Center. It's a memory center, it's locked. I still work, I work 8 to 4. So I needed a place that was open during the day for him. I'm in the business of healthcare, I'm a nurse, and I knew it was coming, but I wasn't prepared at home for that. So when COVID hit, he started staying at home by himself. I had neighbors keeping an eye on him, but that really wasn't working. I would come home many days from work and find him on the floor. So through Senior Citizens Incorporated, they provided sitters, and sitters started coming in for a couple of hours a day. And that really, for me, was an eye-opener, you know, that a center like Ruth Bick meets a lot of needs that you just really can't get in the home. You know, with not only the physical care, but the social interaction, just getting out of the house. You know, the food that they provide, it's just, for him, it's just a much better environment than even being in our house.
You know, one of the things I think that separates what we do versus what other companies that provide in-home services is that nonprofit advantage. We are coming into someone's life not to make a lot of money, but to be that bridge, to be that support that makes it possible for someone to live at home. We understand the continuum of care and that not everybody can stay at home, but we'll help with that transition. And for many families, that's the difference in their loved one being able to live in their home.
Eventually, we needed more care for mothers, so I talked to the folks here and was very pleased at what I heard. She passed away in January. We used them about 12 hours a day. The caregivers that were with Mother really provided all sorts of care, from helping her with meals, and she got dressed every day and wanted to look nice. And maybe the best thing, she loved to go outside. Where she was had a wonderful outside space. And the caregivers would take her out for walks, and that was very meaningful. And so I was very pleased with the attentiveness and the care that they took with her. Very kind, generous people.
Our focus is on making sure everybody lives a life that reflects the dignity that they deserve, and we are the best. That's our goal, and that's what we do.